I'd like to introduce PDO Mono threads. These are absorbable threads and they are collagen stimulating. The amount of collagen production is proven on histology and is proportionate to the amount and therefore number of threads inserted in the area. It shows improvement of skin quality, and it also shows that there is increased vascularity in the area. These monofilament threads are also called mono threads in short, but they have evolved. Now they have turned into multifilament, screws, and lately even hollow tube filaments. In general, these mono PDO threads are not for lifting compared to long threads which are for lifting. After all, they are just suture materials or threads left underneath the skin. But because of the neocollagenesis, which means that they are stimulating collagen production, it also causes a tissue reaction. To some degree, thereby it causes tissue contraction. In some Korean textbooks, they show, particularly in the cheek area and also the lower cheek, causing some degree of tissue contraction for the treatment of the nasolabial fold and the marionette area. More commonly, these threads are placed in areas to support the skin. These can be used all over the place, including the lower eyelid area, as well as the neck and some areas of the body as well. They are used in areas with for static wrinkles such as the forehead and also below the eyes. The hollow tube design can cause some degree of volume changes, and these threads have been designed to reduce deep wrinkles and also being applied in the nasolabial fold areas. Ideally, these threads are placed in the subdermal space, but some authors also suggest that these threads can cause some degree of lipolysis, so they can be placed slightly deeper than the subdermal fat into the superficial fat plane. However, they should not be placed deep into the fat plane, and this could be applied in areas such as the submental area. The design. Here are just some of the examples of a few designs of how mono threads are placed. They are parallel or in a mesh-like manner. Remember the indications and why one chooses the mono threads to treat. The number of threads can also depend on the indications. The most common complication is infection, and this is preventable. Patients must have no makeup and follow aseptic procedure at all times and do not touch the threads or the needles. These areas to be clean and betadine applied prior to insertion of the needles. The other complication is not watching where the needle tip goes. We do not want the needle to go deep, and which could injure deeper structures. Stay within the subdermal plane. If there is a curvature such as a cheek, choose a shorter needle so it's easier to navigate. One needs to push the needle all the way in, otherwise the thread may stick out or cause a small bump after the procedure. It is advisable to make a treatment plan as well as taking photos or photo record prior to removal of the needles. Management of complications. I have seen minor degree of neuropraxia, especially around the marionette line, but these usually resolve within days. I have also seen papules a few days after thread insertion. This can be caused by the end of the thread or inflammatory papule or response at the insertion point. Again, this should settle without treatment. The other complication I've seen is similar to a Tyndall effect when they are placed under the eyes. This is because the threads placed are too superficial or too many of them. Now, the patient has very thin translucent skin. In any case, this will also disappear and the threads are being absorbed. Infection should not happen, but one can prescribe antibiotics if need be. Maintenance. It is advisable to repeat treatment to the area every 6 months for continuous improvement. This can be used preventatively in areas such as the brow or the face in general to improve skin quality.